Right, so bundles of joy born on Christmas Day have been welcomed in hospitals around the country. The Department of Health will continue to share the number of babies born on Christmas Day in different regions. And with numbers expected to rise, we are now joined by the spokesperson for the Department of Health, Foster Mohale, for more. A very good evening to you, Mr. Mohale. Thank you for joining us here on the SABC.
Evening to you, good afternoon to you, and good afternoon to your viewers, and thanks for this opportunity. And Merry Christmas to you and your colleagues.
Thank you so much. Merry Christmas to you too. Perhaps you can actually give us a breakdown of the good news that's coming on this Christmas Day. What are the number of babies that have been born? It seems like Gauteng has experienced the majority in terms of the number of babies.
Yes, firstly, we'd like to, on behalf of the Department of Health, we'd like to congratulate all the mothers and also the healthcare professionals for safe and delivery of this new this bundle of joy. Also, in terms of the numbers, yes, by midday today, we were sitting at just above 500 babies were born between midnight and midday today, and the numbers are expected to rise between now and midnight. So we'll be able to provide the full consolidated statistics in terms of the number of babies, the age of mothers, but also in terms of which province have got the high number of twins and all those things by tomorrow morning.
Yeah, absolutely. So perhaps you can give us a breakdown of the provinces as it stands, given that you said you've been counting for between midnight and midday and you're waiting the other results. I mean, compared to last year, Gauteng welcomed 403 babies on Christmas Day. So when we look at the first births, what provinces were leading? Who was born at midnight?
Yeah, in terms of the numbers are trickling almost every hour, every minute. In terms of the provinces which have reported the first bundle of joy is exactly by midnight. It was a province like Limpopo, which reported the first baby at the hospital called the Bukopani outside Polokwane, together with the hospital like your Tema Hospital just outside in Tonga in the province of Cape. But yes, in terms of the leading provinces is Gauteng, exactly because of the population of Gauteng is far bigger than the population of other provinces. Yes, but in terms of the numbers, yes, we are recording the numbers on the every hour and be able to provide update to the public by the end of tomorrow. But the only concern that we have as the Department of Health is that among mothers who have delivered this babies include the very teenage babies like at the age of 15 years old, and we're very concerned. That means if a mother has managed to deliver a baby at the age of 15, it means that person was pregnant by the age of 13 and 14 years old, which is very concern to us as the Department of Health. And we feel that we need to do a lot working together with the other sectors of the society in order to promote sex education, to ensure that babies, young women don't get pregnant at an early age, because we want them to complete the school in order to become our future leaders.
Foster, I'm glad you brought up that point because, the ages of some of the mothers that have given birth today, whilst we celebrate that, it's obviously of concern. You've spoken about the issue of awareness and education. At the end of the day, this amounts to statutory rape. And I just wonder, given the measures that have been put in place to curb pregnancies amongst the youth, clearly there's a disconnect of sorts. So amongst working with the other departments and perhaps also looking forward, because this is not a new occurrence, it happens, the conversation comes by every single year. What more can be done?
As I said, that this is a collective responsibility between the government, the parents, and other sectors of the society. From National Department of Health, working closely with the provinces, the Deputy Minister of Health, Dr. Spokesperson, is leading a campaign called Sexual Reproductive Health, where we are preaching the sexual health and also the family planning and access to contraceptives for those who cannot delay their sexual activity, like we talk of your condoms and other pills, in order to ensure that the young women and adolescents don't fall pregnant at an early age, but they have to, if they cannot delay or abstain, they rather use these contraceptives which are accessible at our clinics and hospitals. But also, we have listened to some of these young people who said the reason why they fall pregnant because of the judgmental attitude they come across at some of our health facilities, we have established what we call the youth zones in most of the clinics in order to ensure that the young people don't have to queue the rest of the clients at the clinics. They go to dedicated areas within the clinics where they get served by nurses and the doctors of their age, so that they become open and discuss these issues of sexual reproductive health. But we believe that if other sectors of the society can join, we can be able to reduce the teenage pregnancy in the country.
So Foster, with motherhood obviously comes a sense of responsibility and accountability. And on the back of what you've mentioned now, increase in awareness amongst other initiatives by the department and also across, working alongside other departments. Have there been any other concerns that have arisen? I'm only asking this because, there also tends to be cases of mothers who perhaps didn't even attend any antenatal clinics, and they hadn't been booked for deliveries, amongst many other things. This obviously is where you can detect defects and challenges earlier on. And given their age and the sense of responsibility, how would you weigh in on those concerns this time round?
Yeah, no, definitely. Also, you're absolutely correct, because some of these young mothers, they only realize that they're pregnant while it's already late after 3-4 months. Even if they wanted to terminate, we find that it's too late. But we say once you are confirmed to be pregnant, you need to attend the antenatal care, so that the nurses, the doctors can be able to take you through the journey in order to ensure that at the end of the day, you deliver a healthy baby who is going to live a long and healthy life, and also be able to access all the services like your immunization services, where we're able to detect and prevent other childhood diseases. So hence we encourage all those who are confirmed to be pregnant. We've got a program called Mom Connect, where we are able to interact with all these pregnant mothers until they deliver the baby at the age of 2 or 3, free of charge. They're able to interact with the doctors, the nurses, free of charge, through an app called Mom Connect. So we encourage all those mothers who are confirmed to be pregnant to join this free of charge at any clinic or hospital, where they can be able to get all these guidance services free of charge, instead of them going to a doctor from time to time.
Thank you very much for that update, Foster. In conclusion, whilst I have you on the line, I just want to quickly get an update on the situation after the gas tanker explosion in Boksburg. Early on, we heard from the Health Minister, Dr. Joe Phaahla, during his briefing. But I wonder if there are any other updates linked to the patients, linked to the equipment, as well as the staff that have been impacted.
Yeah, well, what we can just emphasize what the minister has announced earlier on during the media briefing, during the site visit to the site, both to the where the incident took place, and also in the hospital, Quartam Hospital, where he did confirm that the number of those who have succumbed to those injuries is rising. It's moved from 10 to 15 today. But what we can confirm is that we also want to urge all the families who have got the patients in the hospital, instead of visiting, they can just call at the hospital to check the conditions of their family members, because for now we have suspended the visiting hours at this hospital while we are trying to address the situation. So we call upon all those who have got the patients in the hospitals to ensure that they just call instead of visiting. They must just bear with us, and we apologize for this inconvenience caused by this incident, but soon we'll be able to announce when we're going to open for visiting hours, so that they can be able to come and see their loved ones.
All right, Foster Mohale, let's leave it there. Thank you very much for joining us here on the SABC. Foster Mohale is the spokesperson for the Department of Health, updating us on the number of babies born on Christmas Day. The numbers shared to date are between midnight and midday. Again, numbers expected to rise. It's already reached over 500, and really also updating us on the incident that occurred yesterday in Boksburg after the gas tank explosion. Mr. Mohale urging those with family members in the hospital to abstain from visiting. The department will announce when they will be reopening visiting hours. Again, thank you very much to Foster Mohale for his time here on the SABC.